Finally, the Princess Alexandra Hospital in November 2013. A good hospital, a satisfactory hospital, or an outstanding hospital?
I think it's a good hospital with outstanding bits and other bits that need further improvement. But external bodies like the CQC have been in. So we had a full hospital inspection in July, and they went pretty much everywhere, and said that they only found minor concerns, and those concerns were things that we knew about. So we still need to do some improvement on paperwork. Our staff need more training, and we're working through that, but obviously it just takes time to get everybody through that. It's not basic training, but things like updates on health and safety, information governance, so looking after people's data, etc. That type of thing. And for me, the really reassuring thing was, if they'd asked us before what we thought we should get, if you like, if it's getting a score or whatever, we would have said exactly those scores. So I think if you've been judged and you feel you've been judged fairly, that's what matters, isn't it?
One thing I've noticed that's come down as well is complaints.
Yeah.
You must be pleased by that. How, I'm not going to visit the sins of the past and how did you get in the first place, but how did you get that down?
So I am pleased that complaints have reduced, but what I want to be clear about is that it's not that we're not listening to people. So we've got those complaints down because we're listening to people earlier. So there's a process, a very formal national process of complaints in the NHS. And what we've done is we had a high number. There were a lot of quite worrying things when I first came a couple of years ago, some quite worrying things that came through there. So we've set a whole process of extending our support to patients and staff, so that on the wards or in a clinic, when an issue arrives, there's support to help people resolve that. Because what you often see in complaints in the NHS, not just here but everywhere I've worked certainly, is that you can, when you have the benefit of hindsight, you can look back and see if somebody had intervened earlier, then we might not have got to that. So the distress for the patient or their relative would have been less, and the hospital could learn and move on. And so what we've done is really clear. We take complaints very, very seriously. We welcome them as they're an opportunity to learn. So if I ended up with a month where I didn't have any, I would be extremely worried, because I would think we're not hearing what's going wrong. Because if you think about the size of the organisation, and if I just give you a measure of that, so operations alone, not inpatient episodes or at clinics, operations alone, we do over 16,000 of those a year. That number of interactions means that things will go wrong, and all we can do is put in systems to make that we reduce the ability for things to go wrong, but also that when they do, we pick it up quickly and we learn from that. So we've also put in place a system called a process called In Your Shoes, where we get patients and their relatives who've had a bad experience, in whatever way they choose to describe that, with staff, and they sit together and talk about that and so the staff listen to how the impact of their actions or lack of actions, or the way they spoke to people, whatever it is, how that impacted on that patient and their family. And then together they work through with the staff and the patients and families what we could do better. So we take that into the organisation as a learning piece and make sure that we keep improving that. So for example, we had on one of our wards a lady who'd been visiting her elderly mother for a long time, and she felt she wasn't being communicated with properly. The staff believed they had been, but when they sat down and talked about how that had gone, they realised they needed to change the way they talked to staff. So there wasn't any bad behaviour or thought they'd been trying their very best, but by listening to that woman about her experience with her mother, that what they've done is put in different systems, that they set time aside in a different way. Very simple things like giving people a cup of tea. I know we are very short of money, we've got a big financial deficit, but a cup of tea is not going to break the bank. So it's that type of thing, so people listen. We've made changes in the way our forms are. We've done various other things to help people, all learning from those experiences.
I'm always reluctant as a journalist to bring in personal experience, but it happens to be that my mother is here at the moment. She was called in here, and I felt and I'm not your cheerleader, that there was a very much open line of communication with myself as the next of kin, with doctors ringing me up when my mother's in the A&E, etc., etc. That communication, the ringing up the next of kin, saying this is the next stage, and involving them, is that a process that you're very proud of and have inculcated into staff?
I am very proud of the staff. When I first came here, the staff were really struggling. They'd had a lot of change, a lot of turnover. They got a lot of criticism, and that doesn't help people do a good job. And what really struck me when I first started, and to every day I get compliments from outside either organisations or patients and their relatives about how friendly and supportive staff here are. And that's our job. Our job is very simple: to make care as best as it can be, whatever our job is. So chief execs don't have to do that much, they just have to ensure other people are able to do their job. And I'm very glad that we're providing good care for your mum. My mother uses this service, as in my father. If I don't feel happy that it's okay for my mum and dad, why on earth should I expect anybody else to use that? But those communication skills and developments are part of the learning. But actually, it's what good healthcare workers, whether they're qualified or unqualified, should do all the time.
Out of shot, there's a lovely picture of a nurse from a couple of years ago. How have things changed from the time that nurse took up her role to today? That may be a very sweeping question, but if you could pinpoint maybe one or two things.
So, well, the nurse looks a lot older now, I have to say, but and feels it some days. But so I think what's changed and what remains the same is very interesting. So I think people always focus on what changed, and I will come on to that. But what remains the same is the thing that made me start my nurse training is the same thing that makes the new nurses and doctors and people who come to work in the hospital come. They want to do their best for patients. They care. And they want to do a good job. That remains the same, and that happens all day, every day, across the NHS. Obviously, I think we do that particularly well in Harlow, albeit that we've still got things to do. I think what's changed is that I think the patients that we receive have the range of services that are in the community are different. So people who come here are probably a bit sicker than the people because they've been managed in the community for a bit longer. I think when I look around, I think the way we use technology is very different, and that's huge advantages. So when I might be revealing how very old I am now, but when I was a student nurse, patients who had gallbladder removed would be in for at least 4 days and probably nearer a week. Now they're in and out in a day because they use the laparoscopic surgery, so keyhole surgery. So all those things change. But when I go and work on the wards with staff or when I'm talking to staff, I think what's really clear is the passion that nurses, doctors, the domestics here are fantastic, portering staff. The thing that makes them want to do a job, it is no different. It's about caring and wanting to be a real public servant in offering something more.
And finally, do you have a 1-year plan, a 5-year plan? Where do you see the hospital in 5 years? So
we're doing that work at the moment. We will. So we haven't got a 5-year plan at the moment, but we will have. And when we've got that a bit clearer, we're going to come and talk to the local population. So we'd love to come and talk to you again, and so your viewers and readers are able to hear that and contribute to it. But broadly, what we want for the hospital is, so we've made huge progress on the quality of services. Now we need to sort out the finances, and it needs to be in that order. The quality of care is always the most important thing. But we haven't got a balanced budget at the moment, so we're having discussions with the clinical commissioning groups, that's the people who buy our services on behalf of the population, about what else we could do differently. They've not got lots of money, they've got more money than us, but they have to spend it on all sorts of things. And what we would like to be clear about, and everybody's agreed this is the right thing, is that the hospital becomes what's called an integrated care provider. So we keep A&E, we keep maternity, and integrated care is about reducing the number of handovers that patients have. So we talked a bit earlier about elderly patients. So if I can use my example, so my parents use this hospital, their GP, they use care services, they use voluntary sector services. They have various conditions between them. They used to be my mystery shoppers, but now everybody knows them. But actually, it's a bit daft, isn't it, that there are so many interfaces, which is basically one couple who need to be supported, and my parents are no different than other people. And if they find it hard to navigate, and frankly, on occasion when I'm helping them, I find it hard to navigate, then we could do a lot better for patients like that. And that's about making sure we have seamless care, so that you don't have to tell your story 5 times or say, well, actually, the whatever doctor told me that, but this doctor's asking me to do something. And we still get it wrong. This hospital managed to send my parents 5 appointments for 1 week, some of which it was physically impossible for them to be in the same. They were, one at this site, one at St Margaret's site at the same time on the same day. Well, why on earth we couldn't have sorted that out and offered them, and we won't. I don't think anybody was picking on my mum and dad. So if we can make that better, it's getting those systems and processes. And the more we do that, the more for patients it's an easier experience, the better we'll provide care. We can intervene earlier or support people to stay at home longer. So people only come, hospital is great when you really need it and you're really ill. It's not a good place to be if you don't really need to be there. For older people, particularly people with dementia, it's a very disorientating experience, and they should really only come here if they need to. So we're doing some work with our colleagues in other parts of the health service about frail elderly people's services and if we can rearrange those. So it's all that sort of thing makes the future of the hospital really exciting.
Thank you very much for your time.
Thank you.